You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my somewhat awesome co-host, we interview the innovators in this space every week. Super excited about today's guest. Ivan, please go ahead and get us started.
Hey, I'm Ivan Zach. I'm very excited to introduce a colleague of mine, Dr. Addie Reinhard. We're going to talk about the topic that I'm very interested in. Dr. Addie Reinhard is a veterinary well-being researcher studying innovative interventions to support mental health and well-being within the veterinary profession. She's a founder and director of Mentorvet. She's partnering with Merck Animal Health to grow and expand the Mentorvet program and is a collaborating researcher on the next phase of Merck Animal Health veterinary well-being study. She has a certificate in veterinary human support from the University of Tennessee and recently completed a master's degrees in community and leadership development and a graduate certificate in college teaching and learning from the University of Kentucky. She is also a certified QPR instructor. Wow. Addie, thank you for finding the time and thank you for joining us.
I'm so excited to be here. Thanks for having me.
You know, the topic, I don't know if you've heard any of our podcasts or any of the stuff that I'm trying to find out about the topic and publish about it. I'm a total amateur in this. I just want to find out how to solve this problem of burnout. And I'm looking more at the angle of management because I think that we're just mismanaging people. And there's a lot, as I was researching this more, I think that we're finding more and more that veterinarians are kind of specific people with specific problems specific to our profession. But then I think we're doing worse on the management side of things. But I'm not a researcher, and I would love to open this up and just maybe start. Where were you starting with this, and why did you decide to dedicate your veterinary career towards solving this problem?
It's a great question. So I actually started my career as a small animal veterinarian. I'm here in the Lexington, Kentucky region and already in my early career. So I graduated in 2015. So in the first 4 years of practice, I already experienced burnout and pretty severe burnout twice. So once at about 7 months out and then once again at about 3 years out. And as I was going through burnout, I also realized a lot of my other classmates were experiencing feelings of burnout as well. And I think it's just such a hard transition. It's such a tough, I mean, we have burnout in the career in other places as well. But I think this transition to practice in this first 5 years seems to be particularly stressful. And so fortunately, I had some pretty good mentors to help me through those feelings of burnout. But a lot of my other classmates did not have that same support in their practices. And so I really started to feel this calling to help support other veterinarians who might be experiencing similar feelings as I was in the transition. And I started looking towards the literature and quickly saw that this was a huge problem that, especially in the early career, it's estimated that about half of veterinarians experience burnout within the first 5 years after graduation. And so it's a huge issue, but also in the literature, there was very little being done. So there's very few evidence-based interventions within the literature of what we're actually doing about some of this stuff. So I actually, I decided to quit my full-time job in 2019 because I wanted to have the time and resources to be able to devote to creating some kind of support program for early career professionals. And what that looked like for me was a mentorship and professional development program. So both mentoring and support, as well as professional development and teaching our veterinarians some skills to cope with some of these stressors that they might be experiencing in this transition.
Wow. I mean, from the entrepreneurial and, this podcast about the innovation, changing the field and pivoting from being a vet to another field where you're stepping into, entrepreneurial path where you don't know if you can support yourself doing that. So really applaud you for that because that's a scary sort of area where you make that decision. But more on the, and this might be a sort of self-served, but more on the burnout in the early stage of the veterinary career. So we ran 2 studies right now, 2 years apart. I think it was somewhat overlapping with the Merck study, but we surveyed 1,500 professionals, and there was all slides from technicians to doctors to administrative staff. And it turned out that the veterinarians, just supporting what you said, statistics are burning out more when they're younger. And that may be generational. There's a couple, theories that I have developed behind it. None of them are evidence-based. But one of them, and I wanted to hear your opinion on this, is that veterinarians are such goal-oriented people. And then from the time they decide to be a veterinarian, most people say, oh, when I was, I decided when I was 10 or 12 or something like that. And then that goal to become veterinarian becoming sort of like a 15 to 20-year goal until they finally do become a veterinarian. And all of a sudden, that whole goal that you were achieving for 20 years, now that's over. So you accomplished, you have your certificate, and now what? And I don't think that, again, there's multiple factors, but I think this is one of them. As soon as you graduate, you go to sort of a complete stall, and then you're just poking vaccines, talking about ear infections, and there's no this very hard achievable goal to becoming a veterinarian. So do you think that's a part of it, not having goals set beyond graduation?
I do think it's a part of it. And I think every step along the veterinary journey, there's always this kind of what's next, what's next, what's next. And once they finally get to the point of practicing, and I felt this too, it's like, okay, what now? And part of that is, learning to be able to sit in that moment and appreciate all the hard work that you did and how far you've come, and be able to just appreciate that moment before jumping into the next what's next. But part of what we do in the program is help them establish some of those goals of what's next for them in their career, because there's always things to learn within the practices. And honestly, the learning process in that first 5 years, there's so much to learn about conflict management, ethical decision making, and so much to be learned in this period that maybe you don't get as much in school. So I definitely think that that is probably part of it. There's, again, like you said, a lot of factors that go into this stress. So student debt, assuming a leadership role, managing conflict, learning how to give care given limited financial resources of our pet owners. This is a huge stressor for early career vets. So again, there's a lot of areas that cause this stress. That is possibly one of them.
It's so interesting, Addie. I guess where I want to go is just a little bit of a different direction. How did you get here? How did Mentorvet become a reality? What did that origin story look like?
Yeah. So after I started in grad school at University of Kentucky in the Department of Community and Leadership Development, I remember the first day of my grad school program telling my thesis advisor that I wanted to create a national mentorship program for veterinarians. And she kind of said, oh, wow. She said, love the enthusiasm, Addie, but let's start small. So let's start with a pilot. So that's what we did. We piloted this program last summer to a group of, we had 7 veterinarians in the very first cohort. We compared those veterinarians to a group of 31 veterinarians who didn't go through the program. But essentially, part of this whole process of getting to that pilot was doing a lot of research. So digging into the literature, learning what the issues are, where do our new grads need more preparation and support. I did some of my own research and focus groups with early career veterinarians to learn what are their needs. And that's a huge thing when we're looking at burnout across the industry is doing that needs assessment and figuring out what are the unique needs of your population, because I would say it differs from the early career versus later in the career and veterinary student. So what are the unique needs of this population particularly, and then developing an intervention surrounding that using some of these evidence-based approaches. So looking at what's worked in the past in the literature and kind of combining that together. So we piloted this program last summer to a small group of vets and found pretty fantastic findings initially with that this program has the potential to kind of prevent some of this early career burnout based on preliminary data. And so I actually, in the fall of 2020, was connected with Merck Animal Health by one of my research mentors, Dr. Elizabeth Strand. And as they were learning about the program, it really aligned with what they were doing already with the Merck Animal Health Veterinary Wellbeing Study, and they wanted to support it in whatever way possible. And so I started working full-time on this project in April of this year with Merck's support and help. So they're really helping me to grow and expand this program. So in the fall, we have 80 veterinarians going through the program and hoping to expand up to 200 veterinarians, which is, again, super exciting. And we use a combination of a lot of different mentoring and professional development techniques. So we have kind of a curriculum, an online curriculum and professional skills. We have peer support group meetings. We have one-to-one mentorship. We have financial coaching, and we have mental health coaching. So we have a lot of different support structures around the early career, because I think the goal is really to create this holistic support network around our early career veterinarians.
That's fantastic.
So is there, I like how you said that, burnout is very different for different population groups. And is there sort of one fits all, or did you develop for different groups is there sort of a screening test? Because I work a lot with consolidators, and what is interesting, what none of them do very well, a lot of them say they do, is basically assessing the culture within the organization, because the acquisitions are happening so rapidly. These, last year alone, there was 1,000 hospitals acquired. You're acquiring dysfunctional team for the most part, and then you're adding it to dysfunctional organization. And as a result, you're losing employees, hopefully just to them quitting, but it can get even worse. So I'm advocating continuously for sort of pre-acquisition check of where the organization is at, where maybe the leaders are at. Is there sort of one fits all test that you can run and say, okay, this group or this individual or these individuals within this group, they're sort of at this level and they need more attention to burnout? Because the worst thing that happens during acquisition of the hospital is that as soon as they take this dysfunctional group of people and acquire them, they put them through a tremendous change management initiative. And then if this group is dysfunctional and half of them are burned out, if you put them through change management, then you lose people. So is there something that groups could use from Mentorvet and adopt as a sort of a system, or maybe contact you and work with you on this? Anything in that?
So we, as an organization and Mentorvet, the program essentially offers more individual support. So kind of a confidential support for individuals, and I think that can be beneficial for any early career veterinarians. Unfortunately, at this point, we don't offer any kind of consulting for determining more organizational burnout at this point. Generally, there are some surveys that can kind of measure burnout. So the Mass-like burnout inventory is one that I use in my own research. So I use the general survey, MBI. So that's one. But again, there's a lot of different measures for a lot of different things when you're looking at kind of organizational burnout. But again, I think Mentorvet we focus on the individual level, but at the same time, we are creating leaders and young professionals that are creating changes within the practices as well, and really setting good examples. So I think we're starting at the individual, but hopefully impacting some systemic changes by providing this good training for our early career vets.
So, Addie, how have you guys leveraged technology, and what does the experience look like if I'm going to be part of Mentorvet's training program? Can you kind of help visualize for our auditory audience?
Yeah, so we actually leverage technology in a few different ways. So we have essentially an LMS that the veterinarians kind of start to engage in at the beginning of the program.
LMS. I know what it means, but
it's essentially where they go and the curriculum is on a website that they can work through, and it's interactive and engaging. So there's lots of different interactive quizzes. There's case studies, and so essentially they work through these modules online, and they cover different professional skills topics. So one topic a month. The first topic kind of goes into self-care and how to care for yourself as a veterinarian. We move into leadership, then conflict management, then ethical decision making, then a little bit around spectrum of care, access to care, to how to provide good veterinary care given limited financial resources. So they move through each of these modules. At the end of each module, we meet once a month on Zoom, and small groups of veterinarians, 5 to 10 veterinarians. They stick with the same cohort each month, which is really fun because it really creates these deep connections among our early career vets because they're meeting with the same group once a month. And then essentially we use social media as well. And I would say definitely when we think about what we're doing with the program, we're leveraging a lot of existing technology to make Mentorvet happen because we're fully virtual, right? We're doing this and establishing these deep connections all virtually, which is such a cool thing to be able to do. And I just love that I have that capability in today's world.
Addie, that's fascinating. I mean, the thing that I found the most interesting is, I think one of the things that leads to burnout is the feeling of being alone. And if you're going to go through a program like this and at the end of it have a bunch of personal relationships that you can lean into, is that by design? And have you already seen the fruits of those kind of relationships kind of be helpful?
Yes, and I think that's probably one of the most important parts of the program. I mean, the curriculum's fantastic and they learn a lot of skills to really help support them and cope with some of the stress, but the people and the support around you, I think is really key. And so from my research and hearing some of the feedback from the early career professionals, that support group and having that support network made them feel not alone. And it really was a safe, confidential environment for them to talk about some of these issues. And then the connections from there, one of the research participants had mentioned that, she felt like now these were all people that she could, reach out to in the future if she needed something, that these were all people that she felt very close with. And some of my own mentees, because we also do one-to-one mentoring, and some of my own mentees still contact me. And that was, we ended the program back in the first round, the pilot in December of last year. So there's still individuals that are reaching out to me, every few months to get some feedback or guidance or support. And so I think really starting to open up some of these conversations of how you're feeling in this tough transition is really creating this community of support that can continue. And part of where we're going with Mentorvet is to really create a community of support all around us, right? So we're supporting the individuals that are coming up behind us. And then we're also having support from the individuals that are one step ahead of us. And then we're also getting peer support. And so part of the vision of this is really to create 360 mentorship where we're supporting everyone around us. And we're starting that with the early career, but I really hope to kind of expand that into other areas, pre-veterinary students, veterinary students, practice management and practice owners, retiring veterinarians, and really create this holistic support and support along the entire timeline of the veterinarian.
So that, I wanted to kind of maybe go from that to a little bit of a touchy topic. Well, for me, for example, so you said, yeah, the support and the ability to talk to other people. And my challenge was when I burned out, part of it, I turned to alcohol and some other addictive behaviors. And I didn't see myself as the burnout. I've seen myself as a loser. And I didn't want to admit a lot of that stuff. But this is when I did find the people that were in a similar situation when I could communicate with them that helped me a lot to get out of that state. So is there sort of a community, or is there expected community where these people can actually connect and openly talk about their problems together? Because that might be an interesting aspect of it, like meetups or something like that, virtual meetups. Is there anything that this sort of network promotes, supports, or you guys are thinking about it?
Yeah, so those monthly Zoom meetings that we do really promote that kind of conversation. And I would say that it's not a ranting session. It's a very highly structured, moderated session once a month with these. So you have 6 veterinarians going through the program together in these small cohorts. And so it really allows them to talk about their shared experiences. And I think that's where the magic happens, is those monthly Zoom meetings, because like you said, having other people to talk to that know exactly what you're going through and are experiencing very similar things, it's really freeing and it's healing, right? If we know other people are experiencing very similar things as us and we hear them talk about this, suddenly you don't feel so alone. You don't feel so isolated. So I think that's a huge part of what we do in Mentorvet every single month. And again, not a ranting session, but a highly moderated, really looking at the process behind a lot of this, these issues that we're facing and how to decrease that stress going forward.
So, Addie, it's all super fascinating. I mean, the one thing that keeps going in my mind over and over again is, how do you scale this up? How do you take this to 10,000, 20,000 people? How do you take it to everybody that needs it? What does that look like? And what are you doing to kind of get there?
Yeah, so it's going to take a lot of people, right? People supporting other people. And so part of this is growing my own team and growing the individuals that want to support other early career veterinarians. And right now, again, we're starting with early career, but really starting to build this support network of individuals. So we're always looking for awesome mentors to help support our early career veterinarians. And really, I think the nice thing about the curriculum is that it's scalable already. And so that's not a limiting factor of our growth is, the curriculum is not, but the people. And so really just getting the word out about the program so that we can grow our human support side of this, I think is going to be the most challenging part, but also the most rewarding part of this work. And I think part of where we get those individuals are also individuals who go through the program, right? So if you've been through the program, then you can turn around and support people who are going through the program after you. And oftentimes those mentors who've been out for 3 to 5 years are often the best because they remember some of the really tough challenges. And so yes, I think just finding the people, and a lot of this comes with relationship building with organizations and other practice groups and tapping into networks that are already existing for mentorship. So we have, for example, a collaboration with the Kentucky Veterinary Medical Association. They sent out one email to their membership about seeking mentors. We got 15 responses. So there's clearly people want to do something to help, and often they don't know how to, but this is a good way that's based in some kind of evidence and science that they can really help support other veterinarians.
Well, one of the drivers of satisfaction in life is actually helping others, and that's one of the biggest dopamine boosts that you can do by helping others, and it's longer lasting than others. Actually, when I was looking into it, we're coming to the end here as usual. We burned through 20 minutes, and that's our promise to the listeners. But I think it's very important to, if you could maybe to those that are listening and potentially not, I mean, for those that know that they're burned out, where do they find you? But for those that are thinking, am I just tired, or this burnout that everybody's talking about? Where do they find more information to say I am or I'm not? Because burnout is sort of the end stage. If you're on the path to that, how do they get in touch with you? How do they find out more about this information? Or those that did go through it and have experience and want to be those sort of mentors and join the network and maybe do some learning? How do people find you and how they join the movement?
Yes, so just all the information can be found on our website, so mentorvet.net, and we have a page on kind of what it means to be a volunteer, as well as a page about the program to learn more if you're interested in joining. And I would say the other question I think you asked there is how to determine if you're feeling burnt out. So the AVMA has a fantastic resource called the Professional Quality of Life Survey. So you can actually Google AVMA Professional Quality of Life Survey. You should be able to find it. And essentially it tells you and kind of gives you an objective measure of where you're at with your burnout, where you're at with your compassion fatigue, so that you can kind of determine where you're at on the scale. Because sometimes we don't notice that there's a problem until it's really bad. So I honestly take this survey every 6 to 12 months just to gauge where I'm at with my own burnout levels. Because again, these range, they occur on a scale. It's not burnt out or not. It's mild symptoms of burnout, moderate, severe. So burnout symptoms occur on a range. And so knowing where you're at on that range and tracking your own trends objectively through one of these surveys can be really helpful. But yeah, don't hesitate also to reach out to me as well, because I have a lot of support and resources and connections that I can provide to people who might be having a tough time in the profession.
Well, we'll definitely link to those resources. We'll find them and put them in the show notes. And Addie, it was an absolute pleasure to have you on the show. We always wrap up in the same way. So first question is a book, a TED Talk, a YouTube video, something that's inspired you or you found really interesting along your career journey thus far.
So I really love the book, Coping with Stress and Burnout as a Veterinarian, an Evidence-Based Solution to Increase Wellbeing. So this was written by Nadine Hamilton, who's a psychologist working in Australia. Her PhD research was on veterinary wellbeing. She's a fantastic human being. So any veterinarian out there interested in learning more about this topic, that provides a really good foundation of kind of where we're at with the literature and kind of some solutions. I think that would be what I would recommend.
Thanks for that.
And the second question we usually ask, do you know anybody in this industry or outside of this industry that would be interesting to interview on this podcast?
So Bernadine Cruz has a really cool new bag called the Conmigo bag. I think she would be fun to chat with and hear about how she, as a veterinarian, has kind of created this new product and how she's getting it out into the world.
Thank Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryin.novationpodcast.com. See you next week.